This is Midday Mobile with Sean Sullivan on FM Talk 106.5.
Welcome back, Midday Mobile on FM Talk 106.5. And again, time for a checkup. And good to see Dr. Engeriser from AltaPointe back in studio. Thanks for coming in.
Oh, thanks for having me.
This subject here is one that we talk about on this radio show. We're talking about the station. I talk about with parents, friends, of mine out there. And that is the overdose deaths in our country involving fentanyl and methamphetamines. This fentanyl thing, though, this is so new to a lot of us here. So first of all, let's talk about what this is. Fentanyl. People, it's in the headlines. What is fentanyl?
Sure. So fentanyl is a synthetic opioid. So it's in the same family as things like heroin or Lortab or morphine, but it's manufactured and it's really potent. So it's 50 times more potent than heroin. And what that means is a tiny little bit of it is enough for someone to potentially overdose on it and die.
I mean, the pictures I've seen of the amount, like they'll show, there was a penny in a picture. Right. Okay. And then there was some fentanyl there. And then off the top of my head, they said this is enough to kill X number of people. It was wasn't even a whole sugar packet. It was like a very tiny amount.
Right. Oh, tiny amount. And for somebody that's not used to taking opioids regularly, just a few grains of it is enough to kill them.
Why is this so popular now? Why has this moved into the...
Well, it's partly accidental that the drug cartels have started to mix fentanyl in the supply of other drugs. So it's a way to...
Is it cheaper for them?
It is. It's cheap for them to manufacture, and it's such a little amount is enough to get somebody high that they can actually smuggle it a lot easier. So it's, mixed into the drug supply of other things like cocaine. But one of the really scary things that started to happen recently is they've started to put it in drug presses to make it look like tablets of other prescription drugs like Lortab or Xanax or Adderall.
So, people think they're right. They're not like a lot of these overdose we're hearing are not people going, I'm going to go search out fentanyl.
Right.
They go to whatever they think they're getting, like you said, a Lortab or an Adderall or something like that. They think they're getting that they may or may not have experience with, but it in fact is not that.
Exactly. And the same thing is happening with methamphetamine getting mixed into the supply. So when we have someone that comes in and they're positive on a drug screen for fentanyl or methamphetamine, they're actually shocked. They had no idea that that's what they were actually taking.
Wow. Okay. So they think, they admit to you, I have a drug problem or I'm taking this drug. And you said, well, yeah, you got fentanyl in your system. And they say, no, I take whatever.
Right. Exactly. Yeah. And really potentially tragic consequences. There was a kind of a high profile case at Ohio State at the beginning of May. College students take Adderall like crazy to try to stay up all night and study for a test. So real common. But 3 students ended up taking a fake Adderall, and 2 of them ended up dying of an overdose.
So even things that they're making them into, I guess Adderall, obviously is abused. But when I started thinking about this thing, I'm thinking cocaine and heroin and that kind of stuff. But even in something that I don't want to say it's innocuous, but I mean, but Adderall pills. There's a lot of people on prescriptions for Adderall that there's no prescription for heroin, no prescription for cocaine.
Yeah, exactly. And what you may be getting at, it's people that don't necessarily have a drug addiction, but it's real common that they might, buy an Adderall from a friend or Xanax for anxiety. And they don't normally use drugs, but if it ends up being fentanyl, it could have fatal consequences.
First time, right?
Yep, exactly. Yeah.
I've heard this, the potency of this fentanyl too. Some of these, you're talking about the stories from the Ohio State students, but then there were some at spring break this year, I think, that were thought they were taking Lortabs or something like that, and it killed, I think, 1 or maybe 2. And the people that were administering like CPR and first aid, it was so toxic. They got the first responders
that happened. There was a famous case this spring break of some West Point students that ended up using cocaine that was laced with fentanyl, and unfortunately some of them died, and some of the friends that were trying to do CPR actually got
just from doing this stuff. I mean, I want folks to listen to this. This stuff is so powerful that person 1 has ingested it.
Right.
Okay, it's in them, and the person that's administering first aid or CPR, there's enough there that they are getting a toxic shock from it too.
Exactly. Yeah.
What's the story here in our, like I talked to law enforcement folks, and different drugs are in different parts of the country more than others or whatever. What are you seeing here along the Gulf Coast? Is it this methamphetamine thing or?
Yeah, I mean, the biggest thing that we've seen recently is methamphetamine has just exploded. I've been at different parts of the country where I've worked at other times where I've seen, waves of it. But this is the worst that I've ever seen in terms of the numbers that we have coming in.
This is the worst of it.
Yeah, it is.
Because I think back, we've had issues with meth here along the Gulf Coast over the past, but you're saying right now.
Right now, and this is relatively recent. I'd say the last 3 to 6 months, it's really taken off. Unfortunately,
are these people that are? Can you tell they're getting on this, or they were on some other drug and shifted to? What do you see?
Yeah, both happens, and part of the reason why someone might shift is that it's really cheap. Unfortunately, it's really cheap. So the street cost of enough methamphetamine to get high is actually less than marijuana. So it's something that people may turn to intentionally. But like I said, it's also mixed in and disguised as other drugs. So someone might take something that they think is ecstasy, but it's actually just methamphetamine.
How do we? I'm going to put you on the spot here. You're not going to. How do we have this parents out there have this discussion with our children, with younger folks? Because believe me, I'm telling them nothing is okay, right? Nothing is okay. But how do we enter into this kind of nuanced discussion that that an Adderall could kill? How do we say that it's all not okay? But
right. Yeah, and again, it's not using scare tactics, but it's giving kids real information. So I've worked in this field my whole career, so I've always been really open with my kids who are now young adults, and they know how dangerous it can be to take something off the street that you have no idea what it is.
So this is good because you're having that conversation. So this kind of it is that. There's all drugs are bad. Don't get into drugs, but there's some of these things out there that first time you take something, you could be dead. Yeah,
and this is something new. We didn't see this a decade ago, but it's something kind of a really tragic new problem that we're dealing with, where someone can use one pill and they end up dead.
Who's doing on the methamphetamines? Like, is it younger? Is it older? Is it what demos here?
It's probably the listeners would be surprised, but it's everybody. It's from all social classes, ethnicities, genders, ages. And part of the reason is methamphetamine is such an addictive drug that somebody that even uses it a few times is very vulnerable to getting addicted to it. It just has that powerful effect on the brain.
The term I've never heard. I've talked about this before in there. I've never heard casual methamphetamine user.
Right.
Never casual.
They may start out that way, but very quickly they will be using.
Are some people more prone to abuse substance than others? Can you look ahead and project that? Or?
Yeah. Well, the question of why some people get addicted to a substance and others do not is very complex. So there are many factors that may play into it, like genetics, social circumstances, a history of trauma, and the particular drug that's abused. So some are more potentially addictive than others.
So there are, we throw this addictive personalities. You hear that all the time. Mm-hmm. There are some people that you think are more easily addicted than person A has this makeup and they get addicted more easily than person B.
Yeah, that's undoubtedly true. And addiction tends to run in families, but it's also very related to people's life experiences. So somebody that has had a childhood history of neglect and abuse is going to be more vulnerable to addiction. And people that are going through life stressors that are turning to drugs and alcohol as a way to cope may be prone to addiction, and that's something we've seen a lot during the COVID-19 pandemic, because people have just had so much disruption in their lives.
Those numbers have been shocking to me. I can imagine through through your position as a physician, as a psychiatrist, somebody who works on this, what they look like. Because just me seeing the news stories, the spike in people that during the lockdown and all that. I guess am I being silly saying they didn't have anything else to do, or why it spiked so quickly, or to deal with the stress?
Yeah, exactly. And we had this phenomenon last year where the life expectancy in the United States actually went down. That hadn't ever happened.
Right.
That was the first time really in our history that was the case.
And it's not from accidents on the farm. It's not from bad water. It's not from it's these drugs.
Yeah, it's drugs and to some degree suicides as well. Those unfortunately have spiked.
What do we do here if if we're talking to somebody directly or family member, friends, they want to get help here? What?
I think the big one message I'd want people to think about, one of the problems we have in people getting help is there's just a lot of stigma about addictions. Sure. And, you'll often hear people say, well, it's easy, just stop using the substance and end of the problem. But it's not that simple. Addiction is a very complex brain disease, and it's not a simple matter of somebody just stopping a substance. It's a tremendously difficult thing to do. And people need a lot of support and a lot of care in order to be able to kick an addiction. So, encouraging family members and friends to get help is probably the best thing that we can do in a non-judgmental but supportive way.
Well, let's talk about that. Contact in AltaPointe. They just reach out to you on the phone first, or what's the best thing to do?
Anyone that wants help, they can just call our Access to Care team at 251-450-2211, and the person on the phone will kind of direct them to the best clinic for them.
And I do want to point out here before we wrap up that I've read here, withdrawal from substances like alcohol or benzodiazepines can be medically dangerous. I've heard this before that like for the alcohol thing, which might probably is the most common addiction, I guess. I don't know if I'm right. They can't just go cold turkey.
Yeah. Something like withdrawing from opioids is really uncomfortable and unpleasant, but usually not life-threatening. But if somebody stops, that's been drinking large amounts of alcohol regularly, if they just stop suddenly, that can be dangerous and even lead to death. So people can have withdrawal seizures, confusion, and it's really important for those people to get medical treatment to help them come off of the alcohol.
So even if a person's listening to us now and says, I can handle it, I can hack this, I can get this drinking under control, just go and...
Yeah, please call your doctor and let your doctor know what you're trying to do, and they'll help.
All right. Great to have you back in here. And that phone number, once again, the Access to Care,
is 251-450-2211.
Dr. Engeriser, good to see you.
Okay, thanks so much.